Good afternoon, everyone, and welcome to SATTC's July webinar, Understanding Substance Abuse, Use, in the Community for Behavioral Health, Substance Abuse, and Faith-Based Organizations.
Welcome to the webinar this afternoon. We will be looking at faith-based organizations, understanding substance abuse and disorders in the community. First of all, I'd like to just take a few moments of thanking everybody to come and join us for these few minutes together to learn. Our goal is to educate, engage, and empower. I'm a licensed clinical social worker that's been in the field for about 30 years. And through the business of sense of equity, we have been able to work with diverse populations, in particular the substance abuse recovering populations. And so this draws me to a subject that's near and dear to my heart. And I find it very important to share this information with you. And I look forward to doing that. Please, if you have any questions, don't forget at the end we will be having a Q&A section. I'd like to share with you a quote. Every addicted person brings with them a distinct personal history which should be listened to, understood, loved, and where possible cured and purified. We cannot fall into the injustice of classifying any individual as if they were objects or broken junk. I think you would agree with me. Rather, every person should be valued and appreciated in their dignity in order to be cured. I thought this was a great way to start out so we can discuss substance abuse. And you see the quote comes from Pope Francis. First of all, the objectives that we're going to complete today. Participants will learn to recognize the signs and symptoms of mental illness and substance use disorders. It's very important to know that oftentimes people are self-medicating. It's difficult and challenging to assess which came first, and so we do use a holistic approach. Participants will also be able to identify the stages of change in the recovery process. The emphasis is on the recovery as a process. We will be discussing the role of the family, church, and community sports in recovery. We will increase awareness of learning opportunities that create an understanding and encourage and help to eliminate any type of stigma. Now, to start off, to get our brains warmed up this afternoon, things that make you say, I always want to start off with taking a look at mental health, the definition of mental health, and the definition of health. Once again, I can't emphasize enough the holistic perspective that is important to embrace. So let's take a look at this. What is your definition of health? A state of complete physical, mental health, and social well-being, and not merely an absence of disease or infirmity. Emphasis, of course, being on physical, mental, and social well-being. So that's health on the one side. And then mental health, a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. The emphasis is, once again, on being holistic and being able to maximize our potential. Even if you have a mental health disorder, even if you have a substance abuse disorder or a substance use disorder, the goal is to help each person maximize their full potential. And these definitions come from the World Health Organization. Now, practical facts about mental illness. I don't know if people are aware how common mental illnesses actually are. About 15 to 20% of every 100 people have a period of serious depression at some point in their lives. The data shows us, the research shows us that 1 out of every 100 people develop schizophrenia at some point in their life. 1 out of every 100 develops a bipolar disorder. The more clients understand the basic facts, and that's what we're here to do today, is to talk about the basic facts about mental illness. The more we understand, the better equipped we all will be in asserting ourselves whether it's for ourselves or for a loved one or another person. And the importance is to take an active role in treatment and recovery. Now, I wanted to point out just some basic information about severe and persistent mental illnesses. And I've just named a few here. Schizophrenia and bipolar disorder. You see from the slides what the definitions are. When you have a diagnosis of schizophrenia, and I do emphasize a diagnosis based on the DSM-5, which is the actual where the actual criteria is. You don't want to just use terms loosely, but you want to make sure that this is exactly what's going on. And the way to determine this is a comprehensive assessment. So if you think someone has the criteria that I'll mention in a moment, please don't hesitate to assist them and reach out and get help. Before schizophrenia, delusions, hallucinations, disorganized speech, grossly disorganized behavior. And like I said, these are brief definitions, but there are a lot of criteria that are specified in the DSM-5, the Diagnostic Statistical Manual. Bipolar disorder, manic episode, major depressive episode, mixed mood. These are the different types of bipolar disorder that a person might experience. It is a distinct period of abnormally and persistently elevated or expansive or irritable mood. Okay, and it is abnormally and persistently increased goal-directed activity or energy, lasting at least 1 week and present most of the day, nearly every day. And so the person diagnosed with this type of disorder would have something called mania, as you see here, heightened energy. But it's called bipolar disorder because you swing between moods, between mania and depression. And we'll get to the definition of depression in a moment. The reason I wanted to once again point out a few of these mental health disorders is because some people try to self-medicate. If you're experiencing any one of these different symptoms, in particular, if you have bipolar disorder and have not been formally diagnosed, you really don't know what's going on. Some people choose to use alcohol to self-medicate. Some people choose to use cannabis, otherwise known as marijuana or weed. They use these different addictive substances to self-medicate because they don't know what's going on. Major depression. Major depression. I did want to spend a little bit more time with this because it is very common. Once again, I can't emphasize enough, help is available. People with major depression sometimes also tend to self-medicate using different behavior, including some addictive substances. But depressed mood, most of the day, this is the criteria again, depressed mood most of the day, almost every day. So take a note of the duration that would have to be in place in order to actually diagnose major depression as opposed to some other disorder. But it's indicated by one's own subjective report. You might have sadness, emptiness, or hopelessness. There might be marked diminished interest or pleasure in all or almost all activities most of the day or nearly every day. Another term for diminished interest that you'll hear sometimes in the clinical world is adhedonia, ADHEDONIA. But you basically have lost interest in doing those things that at a prior time you used to enjoy doing. There might actually be significant change in weight. It might be weight loss or weight gain. So during an assessment, the assessor will look at and ask the person receiving the assessment these questions. You also want to determine if there is an inability to sleep, or they might be sleeping too much, or they might be sleeping not enough. So either end of the spectrum, if you can tell from this criteria, is a concern to be assessed. You know, you hear me mentioning the word assess quite a bit because you don't want to ever jump to any conclusions. There is an acronym that is often used, DDT, diagnosis determines the therapy. And so we're taking time to go through different symptoms that are part of the diagnosis. Another symptom would be psychomotor agitation or retardation nearly every day. So we have a trend here. Fatigue or loss of energy nearly every day. Feelings of worthlessness or excessive or inappropriate guilt, which may be delusional. Nearly, and this occurrence would, the symptom would occur every day, nearly every day. Diminished ability to think. Sometimes people struggle with poor concentration, some indecisiveness, and once again, those two terms by themselves would not be diagnostic unless it's happening nearly every day. Another criteria, recurrent thoughts of death, not just the fear of dying, but recurrent suicidal ideation without a specific plan or a suicide attempt or a specific plan for committing suicide. What we will discuss a little bit later on in the PowerPoint is what to do as a layperson, as a clinician, whatever the case might be, to make sure we keep people safe. There is I call it the CPR way of assessing. It's called mental health first aid, of assessing if a person is in crisis and contemplating suicide. And we'll get to that in a little bit. What are substance use disorders? Now, there are a lot of terms that we're going to go through, and I'm going to take it slow to make sure that you know the differences. Now, substance use disorder, keyword there, use. Harmful or hazardous use of psychoactive substances, including alcohol or illicit drugs. Please know that people often use the term alcohol or drugs. Know that alcohol is a drug. It is a drug. And here they've clearly done a great job in saying alcohol and illicit drugs. Okay. Again, substance use disorders, they can lead to a dependence syndrome, whether it's behavioral, cognitive, psychological, and it actually, the key is repeated use of that substance. And that typically includes a strong desire to take the drug, difficulties in controlling the use, persistence in using the harmful substance despite the consequences. Oftentimes, you will find that people have chosen to use the drugs because they're addicted to the drug, and they actually are losing jobs. They are not paying attention to their daily responsibilities. Clearly, that's a sign of someone that has a substance use disorder, at least one of the criteria. A higher priority given to the drug use, this is also another symptom, than to other activities and obligations, as I mentioned. Increased tolerance for the drug, and sometimes a physical withdrawal state. So these are all things that we want to pay attention to. Substance use disorders, again, there are levels of severity. There's mild, moderate, or severe. And it's based on, once again, that diagnostic criteria. Mild, basically meaning that the symptoms interfere at a low level in their lives. Moderate, a more significant impact. And severe, of course, the level of daily functioning is impaired. It's impaired at the highest level. You're not going to work anymore. You're not taking care of your daily responsibilities, especially your activities of daily living are not being adhered to. You're not doing them. Another sign, recurrent use. Oftentimes, people don't notice their own trend and beginning to use more and more. It goes back to that term high tolerance that we were talking about, or a higher tolerance. Use of alcohol and or other drugs causes significant impairment, such as health problems, disability, and failure to meet, like I mentioned earlier, major responsibilities at work, at home, or at school. A diagnosis of substance use disorder is based on the evidence of impaired control, social impairment, risky use, okay, high risk behavior, and pharmacological criteria. Now, we have talked a lot about substance use disorder, but what's the difference between a substance use disorder and a substance induced disorder? Substance use disorder, okay, what we want to highlight is the negative consequences of continued and frequent use. So we were wondering whether a loved one had the issue, or even perhaps if our behavior evidenced negative consequences of continued and frequent use of substances. These consequences are not immediate, and this is going to be one of the key factors that draws the line between substance use disorders and substance induced disorders. The consequences are not immediate, but they occur over time as the addiction progresses. Now, substance induced refer to the immediate effects of the substance. Sometimes it's in the form of intoxication, other times it's in the form of withdrawal. But like I said, the difference is the immediacy of the impact of this substance on our bodies and our lives. So when we are noticing these trends, okay, we have the criteria. We know what it would look like if a person was actually experiencing the different criteria, whether it's a mental illness or whether it's a substance use disorder or a substance induced disorder. So when do we have an addiction? What is an addiction? It's a condition that results when a person ingests a substance, it could be alcohol, methamphetamine, cocaine, any type of drug like that, addictive drug. The person engages in an activity, gambling, sex, shopping, and notice an addiction is not just for substances. You can see that based on those first two bullets. Okay, people can be addicted to work, they can be addicted to shopping, they can be addicted to any other type of behavior, but it's the frequent use, it's the putting that behavior, that addictive behavior, whatever the focus might be, in front of work, home, or school. That's when we know that we're going down the road to an addiction. Now, the activity can be pleasurable, but continued use, the act becomes compulsive. And we're getting into the fact that people begin to have cravings for whatever the activity might be. And I'll just pause for a moment and mention that gambling tends to go under the radar. It is an addiction that many people have, but because it's not readily noticed and is not as easily identified as the impact of a substance on a person, like I said, once again, it tends to go under the radar. But when someone has an addiction, it interferes with their ordinary life responsibilities, like we mentioned before, such as work, relationships, or health. I want to pause there. A lot of folks believe that as long as they are able to go to work, they don't have an addiction. As long as their relationships are in place, they don't have an addiction. Please note that when you are diagnosing, when you are looking at signs and symptoms, it might not be that a person who is able to go to work and they're still using, that does not mean that you don't meet the criteria. And that's why you saw those other pieces of the criteria, that you want to pay attention to all of them and look at the frequency, look at the consequences, not just in one area of a person's life, but in all areas. Users may not be aware of their behavior, or that their behavior is out of control and causing problems for themselves and others. Denial is something that's very serious, and it enables a person to continue the behavior of addiction despite the consequences, because they just don't believe, they just don't see the problem that it's causing, or the problems that they are causing. Now, substance intoxication, okay? A reversible set of symptoms due to the recent use or exposure to a substance. Okay, we talked about intoxication and withdrawal earlier being substance-induced disorders. Symptoms will vary according to the substance, whether it's alcohol, cocaine, marijuana, crack, methamphetamine, different types of opioids. Okay, so the knowing that the symptoms might vary is important. Intoxication occurs because a chemical substance, such as the drugs, directly affects the central nervous system. This leads to behavioral and or psychological effects. Know that when a person's using a drug of any type to the point of substance intoxication, they can become delusional. We mentioned earlier the not cross addiction, but the fact that some folks self-medicate. Some folks might think they have a mental health disorder when it actually their using behavior is causing the the delusions. And so know that oftentimes it will be important to tease out the mental illness versus the substance use disorder or substance induced disorders. Substance withdrawal, diagnosed based on the behavioral, physical, and cognitive symptoms. And that's important to know the behavioral, what a person's acting out, what they're doing, the physical, as well as the mind, the cognitive symptoms that occur due to the abrupt reduction or cessation of the substance use. Okay, there will be sometimes some very serious consequences for stopping the drug abruptly. An example would be alcohol intoxication. You know, when you stop using a drug, using alcohol in particular, you could go through withdrawals. You might have heard the term delirium tremens, and the need for detox for some drugs is very important. Notice that I said for some drugs, but not all. Some drugs do not require detoxification. And as you see with the next bullet, the use and discontinuation of some drugs, it doesn't result in withdrawal. So it depends on the type of drug that has been ingested. Alcohol related and addictive disorders. So we've talked about a little bit about substance use disorders. Now we're talking about alcohol use disorders, alcohol intoxication, and alcohol withdrawal. The abbreviation for alcohol use disorders, AUD, the criteria, problems controlling intake of alcohol. Because alcohol tends to be a widely used and acceptable type of addictive substance, oftentimes, I mentioned the word denial. People are in denial about the extent of their drug use. The same thing occurs with other drugs, although marijuana is not legal in some parts of the country, it is, but not paying attention to, once again, how much am I using? You know, is it being disruptive in any area of my life? So I just wanted to point that out. But another criteria for AUD, continued use of alcohol despite problems resulting from drinking. Development of a tolerance, drinking that leads to risky situations or the development of withdrawal symptoms. And once again, the severity level. Is it mild, moderate, or severe? How much is it interfering with your life? How much is it impacting your life? Opioid use disorder criteria. A minimum of 2 or 3 is required to diagnose mild substance use, while 4 to 5 criteria is required to diagnose moderate opioid use disorder, and then 6 to 7 so for severe opioid use disorder. Some of the symptoms, taking the opioid in larger quantities, larger amounts for longer than intended. I want to pause there. Using opioids or any other drug for periods longer than what you intended and larger amounts than what a person used in the past. That person is possibly working their way to a higher level of tolerance, which means their drug addiction is progressing. A person wanting to cut down or quit, but not being able to do it. Spending a lot of time obtaining the opioid. Craving or a strong desire to use opioids, despite, once again, despite the consequences. Repeatedly unable to carry out major obligations at work, school, or at home due to the drug use, due to the opioid use. Here's some additional criteria. Continued use despite persistent or recurring social or interpersonal problems caused or made worse by the opioid use. Use attempts to stop or to reduce, stopping or reducing important social, occupational, or recreational activities due to opioid use. At this point, you see the trend. A person addicted to opioids is increasingly putting the opioid use at the front of their daily activities. That's their first thought. That's what they want to go out and seek and get, even if it means missing work, not taking care of their children, not taking care of family and other responsibilities, daily responsibilities. Recurrent use of opioids in physically hazardous situations. As with alcohol, some folks might have DUIs. Opioid use will lead to some high risk behaviors as well. Consistent use of opioids despite acknowledgement of persistent or recurrent physical conditions. Looking at your health. and the psychological difficulties that are resulting from the use. Once again, tolerance. So we've got some patterns uh, that we see in terms of that addictive behavior we want to pay attention to. Tolerance, making or having markedly increased amounts to achieve that certain level of desired intoxication. At the same time, as a person wants to use more, the impact or the effects of how they feel, how it's making them feel, you see from the this bullet point here, it's diminished. So you're using more and you're getting less of an impact, which causes what? It causes a person to want to use more, trying to get that initial desired relief, impact feeling, whatever the case might be. Withdrawal manifesting as either characteristic syndrome, or the substance is used to avoid withdrawal. You might have heard or experienced people that actually will use whatever the drug might be, opioids, marijuana, alcohol, first thing in the morning to get themselves going because they feel that they might be going through a withdrawal. Their body is reacting in a way, and they know if they put that substance back in there and their into their bodies, that it will take away the uncomfortable feeling that they have. Once again, for a drug that requires detox or can require detox, like alcohol and some other drugs, it's very important. It could be life threatening if a person does not seek medical attention immediately. Now, we've talked about mental illnesses, we've talked about the definitions of a few, we've talked about alcohol use and other substance use and substance induced disorders, along with taking a look, and now it's time to take a look at stages of addiction. Okay, we've defined addiction, but what are the stages, you might wonder? Well, according to Perchowski and DiClemente, their stages of change model helps us better understand at what point a person might or might not be ready for change. You see a few listed here: pre-contemplation, contemplation, preparation, action, and maintenance. And now these are listed pretty quickly, but a person can go back and forth from pre-contemplation to contemplation. They can go through all of these stages, all the way through maintenance, and then go back to pre-contemplation. So it's a process. It's a process. Pre-contemplation. Basically, what we're talking about is not currently the person is not currently considering change. You've heard the term ignorance is bliss. They're just not ready to make that change, and that's okay. The important thing as we go through these stages of change, I want folks to know that person-centered approach is crucial. Accepting people starting where they are is very important, as opposed to trying to force someone to make that change, because it is up to them. No one can make someone get into recovery. We can encourage, we can try to motivate as much as we possibly can, but it is a very personal decision to decide and make that leap to ask for help. So, some ways to intervene if a person is in pre-contemplative, the pre-contemplative stage. Start small. I can't emphasize that enough. Baby steps is very important. Validate the lack of readiness, like I mentioned before. There is a term called harm reduction, where folks are encouraged to just use less of the substance as opposed to total abstinence. And there's some research that's out there that individuals can seek out and learn more about that. But validate the lack of readiness. At the same time, acknowledge what they are able to do. Once again, person centered. Clarify, emphasize the decision is theirs. It's their life, as difficult as that might be for family members. It is definitely difficult to watch a loved one not make the right decision and choose to stay in that addictive state and not make any changes despite the serious consequences that might be occurring in their life. Encourage reevaluation of the current behavior, a positive approach the entire time. Encourage self exploration, not inaction. Explain and personalize the risk. Educate regarding their health. Discuss clients' feelings and experiences, and don't assume the client is ready to change. Once again, a person centered approach. The next stage, contemplation. You might ask, what is this? Ambivalent, the person might be ambivalent about change. Another way of saying that is sitting on the fence. They're just not really sure. A lot of folks enjoy the feeling of being high. They enjoy the release that it provides. At the same time, that allows them to remain in denial about the serious consequences of their behavior. When you're in the contemplation stage, you're not considering change roughly within the next month. You're not there yet. Some options, some ways to intervene. Validate once again the lack of readiness, and you're going to probably see that consistently throughout, just starting where the person is. Clarify that the decision is theirs. Talk about the benefits and the barriers to change. Talk about the fears. Encourage evaluation of the pros and cons of their behavior. What will it be like to your family, friends, and themselves for them to remain in their current state? And what might be the pros if they decide to slowly but surely make a change? It's important to identify those personal barriers and those personal reasons for wanting to make a change, and encourage short term achievable goal setting. Once again, the baby steps along the way, and celebrating those baby steps when a person is able to accomplish that task. A person might go from using the drug from as opposed to daily, maybe 5, 6, 7 hours a day, to every other day. It's not the preferred outcome, but if that's the best the person can do at that point in time, that's still better than continuing to use 24/7, 365. I think you would agree with me on that. The next stage, preparation. Some experience with change, trying to change, testing the waters. So at this point, we've moved past pre-contemplation, we have moved past contemplation, and now we're in a stage called preparation. Once again, accepting where they are, be supportive. Be supportive, and actually, I want to pause for a moment. Support is not the same as enabling. When you look up the word enabling in the dictionary, you find one definition. Enabling, when you're talking about addiction, sometimes people tend to make life easy so they don't see the consequences of their behavior. That's enabling. So that's not supportive. You want to be real, be direct, and provide constructive feedback, but not enable the person to not look at what's really going on and the challenges and the consequences of their behavior. Identify and assist in problem solving. Reinforce all positive progress. So you see that's been throughout the different stages, all of the different stages. Help the person identify social support, real social support. And I'm going to pause there. I've worked with a lot of people in drug courts, a lot of people in the substance abuse field, trying to get in recovery, and oftentimes they might have family members. It might be a parent, might be a sister, brother, might be a close friend that also they've been using with. And they might see that person as a support, but if that person is an active addiction, that's going to be a hinder, that's going to be a barrier. So once again, embracing where the person is, but at the same time, speaking quite frankly about how hard it would be to maintain or even get into sobriety if you're in the so-called lion's den, expecting the lion not to bite you. So changing playgrounds and playmates can be very difficult when those playgrounds and playmates are very close friends and family members. I say this, but oftentimes people forget that yes, it is difficult, and yes, they have a choice. They have options. I often tell people just because something is difficult doesn't mean you don't have choices. When you look up the word choice in the dictionary, you don't find it next to the word easy. So I tell them to embrace their God-given choices, use a healthy support system where folks are in recovery, where they can actually help a person get back on track. Verify that the patient, the person has underlying skills for behavior change. And I'll pause there as well. There are many coping skills that individuals actively use on a daily basis to maintain sobriety. I can't emphasize enough the millions and millions and millions of people in the world that are successfully and have been successfully recovering. And so there are steps, there is support, whether it's through a 12-step meeting, Celebrate Recovery. There are a lot of options. So as when people are in the preparation stage, they may not be aware of them, letting them know, educating them, engaging them, empower them, whatever it might take to help them to be successful is very important. I mentioned encourage the small initial steps once again, because these small steps of accomplishments, they help to build the person's confidence, and that's very important. Know that that for them to know that you believe in them, that you know that they can do it, that is planting good seed, and many people begin to believe that they can do it in small steps as well. It's not meant to do this by yourself. It's not meant to do this in isolation. It is meant to do with help. Once again, going back to the importance of accepting and asking for receiving help. Help monitor gains and decrease barriers, like I mentioned before. Signs of readiness to change. Less resistance. The person will be less resistant to asking for help, like I mentioned. Fewer questions about the problem. Self motivational statements. More questions about change. You'll see their curiosity increase about what can I do to change. They'll start using those skills on a more regular basis. They start becoming more hopeful, looking ahead, and experimenting with change. Action. Practicing new behavior for 3 to 6 months. Some intervention techniques include providing continued encouragement. Now, I'll pause there. You will see that we have talked about a person centered approach. We've talked about continued support and continued encouragement throughout the entire process, throughout each and every stage. Discuss ways to slowly increase frequency, intensity, and time. An abbreviation for that is FIT. Combat feelings of loss. And when you think about, for many people that are addictive that are addicted and have been addicted for many years, when it's time to give up that drug, when they make the decision to take that move, make that action, it is a grief and loss issue. We all are probably familiar with the stages of grief and loss. This is a loss, and that's not to be minimized. They are now faced, for many, whatever they were doing 7 days a week, 365 days a year, 24 hours a day, they now have I think you would agree, a whole lot of time on their hands. And it's very important for us to support the person in recovery and to help them put the pieces back together, find a job, reactivate hobbies that they had put down before, they had stopped doing because the drug life had taken over their entire being. Reiterate long-term benefits. Once again, that's part of encouragement, and help to plan ahead for changes in routine, like vacations and illnesses. We want to make sure that that doesn't become a trigger. I'll give you an example of someone in an action stage and having to make a decision. There was a gentleman that was addicted to alcohol, and he used to sit in his chair and drink alcohol. Favorite chair, always watching baseball. So he was into recovery, but found that he was still sitting in the chair. Now you have a Coca-Cola or some type of soda or beverage in his hand, still watching the baseball game. What happened in this case, he realized, because he struggled with maintaining that sobriety at some points, that even though he was no longer using, The behavior, many of the behaviors were the same, and he continued to put himself in really high risk situations that he had not previously recognized. And once again, once he changed those behaviors, used some coping skills, found other hobbies, activities to replace the other behavior, his success rate was a lot higher. He accomplished what he wanted, which was sobriety. So I wanted to give you that example. Maintenance, continued commitment to sustaining new behavior. Keyword commitment to sustaining that newfound behavior. Some folks are not, depending on how long they've been using, they're not returning to prior levels. If you started using at a very young age, 12, 13, 14, or even prior to that, and you've used for 20 years or so, you are not necessarily returning to the behavior of a 12, 13-year old or whatever age you were when you started. You want to do better than that. And that requires, once again, support, helping the person realize what might those activities be? What am I going to do to maintain and sustain my behavior 20 years down the line now that the person is interested in recovery? The time frame here for maintenance, post 6 months to 5 years. 5 years. How to intervene? Praise and feedback are still important. Offering and reinforcing the use of community resources, and the list is vast. There are a lot of tools. We call them toolboxes. A lot of tools in your toolbox you can use to maintain sobriety, because routine can become an issue. It can become boring to anyone, and the person might want to seek new challenges. Help them to frame that in a way that, once again, is person centered, what they want to do, but just in a healthy manner. Plan for follow up support, reinforce internal rewards, and discuss coping with relapse. Oftentimes, people see relapse as a failure. It's actually an opportunity if it does occur. Relapse is more common than what people want to actually sometimes acknowledge. But once again, what went wrong? I've seen people relapse. They after a while, a short period of time actually, they take advantage of the information when they're in therapy, and they look back to see what went wrong. Sometimes people have placed themselves right back in the lion's den, like I mentioned earlier, and didn't even realize it. They did not even realize it, and then they became triggered. It's very important in the recovery process to know and learn what your triggers are. Very important. Like I mentioned, the gentleman watching the baseball game, all he had done is switch out the Coke, Coca Cola or the beverage for the beer, but it was still a trigger for him. So it's very important. Reminder: relapses are temporary. They can be temporary. They should be viewed as a setback that is a setup for a comeback. Once again, it's a learning situation, not a failure. Not a failure. So it's very important for the person to reconnect and get back into their using the recovering community and other resources that they were using prior to the relapse. Relapse, the resumption of old behaviors. Once again, evaluate the trigger for the relapse. Reassess the motivation for change and the barriers to change, and plan stronger coping strategies. So it provides a relapse actually provides information about what works and what does not work. Help is available. Help is available. A person can move from impossible to I'm possible. How do we do that? There are a host of effective evidence based interventions that provide help, support, advice, guidance, and assistance. Once again, help is available. I just wanted to throw out some information that is an effective evidence based modality that is used to help people get back on track and stay on track, and it's called motivational interviewing. The strengths of motivational interviewing: it's non confrontational. I'm going to say the word again: person centered. starting at the stage of readiness where the person is. The hot seat that, confronting, trying to make somebody change is counterproductive. We want to use an empathetic style. Um, the motivational interviewing is supported by research. It's successful with different high risk populations, successful in brief sessions, and no type of specialist is required to do this. You can use this, anyone can use this type of skill, this type of intervention. Motivational interviewing, it offers information, encourages and supports, validates whatever the person might say or whatever they might do. It validates their experiences and their feelings. It makes change the responsibility of the participant, which is most key. Most key. Motivational interviewing. In motivational interviewing, once again, you want to avoid telling a person how to run their life. You want to avoid telling the person how to accomplish sobriety, because the way people accomplish sobriety, it differs. The good news is that it can be different for every person. That toolbox I mentioned before is vast, and so recovery is available in a way that works for that person. You also don't want to try to convince the person to make the change. Once again, just start where they are. It might be uncomfortable for the family members or the person really wanting the other person to change, but there's help and support for that as well. And we'll get to that when we talk about the role of the family and the faith-based community in the recovery process. Understanding ambivalence is a part of helping people, and that's a part of motivational interviewing. Know that ambivalence is normal. We talked about the stages of change a few minutes ago, from pre-contemplative all the way to maintenance, and I also mentioned how it can fluctuate between stages. Ambivalence is not only normal, it's acceptable. It's acceptable. And it's our job, it's our role. It would be helpful to the other person to just gain understanding about that. Attachment to the behavior is a part of ambivalence. That's why it's so hard and difficult for a person to give it up. Are they ready for change? Do they want to actually give up the substance for we're going to what we perceive as a better life, but they may not know what that looks like, and it might be very scary for them. Ambivalence tips back and forth, just like you see in this slide. Motivational interviewing. I'm not going to do the videos that are attached to this, so we'll move on and talk about thinking for a change. Okay, thinking for a change is actually an evidence-based curriculum that helps people in the recovery process. Thinking controls our behavior. Okay, thinking for change focuses on active listening. Okay, asking questions is important for the person working on changing their thinking, working in recovery, to actively listening to the feedback being provided, asking questions, asserting themselves and asking questions, and giving feedback, because they are a part of this entire process. And it's important for individuals to know their feelings and pay attention to their own thinking. Our, we want to assist people as they recognize the risk. We mentioned in looking back at the different signs and symptoms and criteria for addictive behavior, high risk behavior is a part of that. High risk behavior can be a subjective type of subjective type of perception, and we want to make sure that we're very clear in pointing out the different behaviors. When you were drinking and got your DUI, you know, look at what contributed to getting that DUI. What was your behavior like? It's a very slow, methodical process, because changing our thinking is just that, a process, a slow and methodical process, but still something that we can do. I've seen many, many people benefit from using Thinking for Change and being in a program that has Thinking for Change. It's important for them to get used to the new thinking. Okay, a part of that is a thinking check-in. Just to elaborate on that for a moment, a thinking check-in is it's often helpful to use something called a thinking report. In a thinking report, it helps a person look at their thinking behind the thinking. their underlying thoughts and feelings, their underlying attitudes and beliefs. Okay, if you can think back to the Titanic, when the Titanic was the state of the art type of vessel, and it still had a catastrophic impact because all they could see was the tip of the iceberg, which was 10%. What was missing? The 90% that was below the water. In our thinking and in our daily lives, people only see 10% of our behavior, and they don't know, and oftentimes individuals are not aware of their thoughts and feelings and underlying attitudes and beliefs that are driving that thinking. And that's what is important when you're in the recovery process. It's important to be aware of, what are you telling yourself? What are the thoughts and the feelings behind this using behavior? And problem solving is another very big part of thinking for change. The role of the family in the recovery process. Four ways family members can play a positive role in the addiction recovery process is to know that going to treatment is not a fix all. A lot of times, family members get very excited, and rightfully so, about the person getting into treatment. That is the beginning of the process. And depending on why the person entered into a facility or began outpatient treatment, whether they're pre-contemplative, contemplative, whatever stage they might be in, it is something that takes a while for them to grasp and for family members to see the results that we all desire to see. But there are a lot of moving parts, a lot of dynamics that we've already discussed that go into successfully ongoing recovery, maintaining recovery. You and your loved one may face ongoing hardships, recovering from a debt or other financial difficulties, gaining or regaining steady employment, ongoing health issues, rebuilding relationships and trust. And that last one, that word trust, can be a challenge for many family members for obvious reasons. Being able to trust your spouse, trust your sibling or your child. As opposed to some other behavior that might have gone on previously that made you decide not to trust them. A lot of family members have had the person that's addicted steal from them, and so it's hard for them to build that trust. Once again, I've been doing this for a very long time in public sector, private sector, and I've seen a lot of success stories. But it's not by osmosis; it's a process. It's a process. The role of family in the recovery process: stay involved and be supportive. Most importantly, get help for yourself. There are agencies out there that offer outpatient therapy. You could get involved in Al Anon, there's Alateen, Alatot. All of these things are designed to help the person, help the family member dealing with another family member that is seeking or in recovery to help maintain their health and their wellness. It's very important to do that. It is a family disease. And it impacts everybody. So we want to make sure everybody has the opportunity to get individual help as well. Like I said, find support for yourself and understand and reduce stress and understand what it means to do that. Family members can dip into their toolbox as well, and use coping skills and strategies that in the midst of these dynamics, they can become healthy. I will add a note here. There are oftentimes, and I've seen this too, when family members they feel differently and maybe more different than they anticipated when a person does get into recovery. At first, they were gung ho, they were excited about it, but now this person in recovery is well aware of a lot of things that are going on, whereas the substances were numbing them before. And so they're now making better decisions, making better choices, and that's an adjustment for family members, spouses, siblings, whatever the case might be. That can be a challenge for them because they were used to being in control, and now this person is getting better and, like I said, making better choices and decisions. So those dynamics can be addressed. It's important to address them throughout the different stages throughout the process. I mentioned the word get involved. Oftentimes, when a person is going through recovery, there might be moments when there are crises. A person might become suicidal or homicidal. It's important to know what to look for if a person gets to the point that they are in crisis and they're thinking about hurting themselves or hurting somebody else. And so I just wanted to share this resource with you. You might have heard of it before. It's called Mental Health First Aid. Just like CPR helps a person with no clinical training assist someone with a heart attack, mental health first aid and training helps a person assist someone experiencing a mental health crisis, such as contemplating suicide. The goal, of course, is to help support an individual until appropriate professional help arrives. And so this is a training that's available to anyone. Anyone can sign up for it, and it is valuable information. Once again, a way to, in a positive, healthy way, support your family member. Mental health first aid briefly. It's an 8 hour course that gives people skills, which is important, to help someone who's developing a mental health problem or experiencing a mental health crisis. This could be mental health or substance abuse, either one. The evidence behind the program demonstrates that it does build mental health literacy, helping the public identify, understand, and respond to the signs of mental illness. And so it puts you in prevention mode as opposed to a reactive mode. What do people learn in mental health first aid? Well, you learn to assess risk respectfully, listening to and supporting the individual in crisis, identifying appropriate professional help and other supports. It introduces it's an introduction to risk factors and warning signs for mental health or substance use problems, and we talked about substance use earlier. Um, and it helps a person to engage in experiential activities that build an understanding of the impact of the illness on the individuals, not just the individuals, but the families, and learn about evidence-based support um, of treatment and self-help strategies. Now, it's important to note that in the faith-based community, having someone go through this training, having someone familiar with the information that we shared, this once again is going to put us on the side of prevention as opposed to reaction. Um, Churches can, and I'll give you an example, Celebrate Recovery. You might be familiar with that. It's an organization that's often found in faith-based organizations in churches. It gives people an option if they're not interested in going to 12-step meetings. They have Celebrate Recovery meetings that are available. And this is just where to find additional information and support. Are there any questions? I will read one question that came up. Um, is the program going to continue with information about how faith-based communities can support recovery? The emphasis there is on not just on Celebrate Recovery, but the emphasis is on the information shared about recognizing the signs and symptoms. Oftentimes, people, I'm in the counseling ministry at my church, and we find that individuals, they are in denial. They have not been in treatment. They have not received a comprehensive substance abuse assessment. So where the faith-based communities can help is directing people to the resource. And like I said, DDT, diagnosis determines the therapy, making sure the person gets a comprehensive assessment. Now, in the meantime, okay, I mentioned Celebrate Recovery, but I also want to emphasize 12-step support groups. Some churches do have support groups in their facility, and there are many resources around town. There are also online 12-step support groups that are available. So it's very important to know how to tap into those resources. Another question that is coming up
Dr.
is,
Rick,
yes, ma'am.
and we're going to take one more question, and this
Okay.
will be our last question for the day.
Okay. The question is there an experiential drug to cure drug abuse? Very fascinating question. Um, there are behavioral changes that people can make in changes that people can make in their lives to help them. There are drugs to support the change, but a drug that's going to cure per se the drug addiction, not to my knowledge. Not to my knowledge, but pharmacotherapy, which is the marriage between medication and therapy. And I have to emphasize the marriage between the two, not just one or the other. So that's crucial. That's crucial. So thank you for those great questions. I hope that I have answered them to your satisfaction. Please visit my website if you need any additional information or if you're interested in any other types of training.
Thank you so much, Dr. Ricks. This was such an informational and comprehensive webinar. We learned so much and seeing things from a different perspective. Again, if you would like to have any additional questions answered, please feel free to email Dr. Ricks at the email on your screen, and as well the website information, and the webinar actually recording will be on a website as well. Thank you so much for joining us. Thank you so much, Dr. Ricks, and you all have a great day.
All right, bye-bye. Thank you.